the presentation for today is on advanced pharmacy practice and hospital pharmacy specialization. So as we all know that there has been a shift in pharmacy practice over the years, and we have shifted from being just drug-oriented to becoming more patient care oriented. So this topic would do justice to how much we as hospital pharmacists need to specialize in different fields so that we can provide basic and better care for our patients. So today we'll be looking at this outline. It's actually a study that was carried out at the University of Ilorin Teaching Hospital. So we'll be looking at some of the results of this study. Please, the next slide. All right, so as pharmacists, we are expected to have professional expertise so that we can effectively manage our patients' cases, especially when we have patients that have complex illnesses or patients that have lots of medications that have to be combined. And like I said earlier, that the healthcare system continues to evolve and continues to change. So we are faced with a challenge whereby we need to have a better understanding and where we can take on more roles that are more specialized and more advanced than what we have in present times. Okay. Okay, so recently, pharmacists that are working at a level of recognized advancement or pharmacists that have higher set of competencies have been seen to improve and then safeguard patient safety and effectively manage complexity in many areas of expert practice. So over the years, it's been found out that pharmacists that have advanced knowledge or that have specialized in specific areas, oftentimes they are able to do much more better in different fields of practice than pharmacists who are unable to do this. And also, it's been found out that other professional colleagues, those are the physicians, the nurses, physiotherapists, and co, have recognized pharmacists that have this advanced practice better than they recognize general practitioners. So, for example, this is a case of a critical care pharmacist who practice in the UK. And this pharmacist, their presence in medical patients' health, overall health, has been shown to decrease the cost of healthcare management over the years. And so providing these services to patients, we as pharmacists need to have good developmental pathways in our practice. All right, okay. So like I was saying earlier, that for us to be able to provide these services, we need to have a clear developmental pathway right from foundation, even right up to practice. And this has to be an advanced form of training so that we can have the opportunity to be formally recognized as specialists. So, like I said earlier as well, that the profession has dealt with several obstacles, such as gaining recognition of our capabilities and activities by other healthcare professionals. But I believe that if we take on more specialized roles, very soon we'll be much more recognized and become more visible to both other healthcare personnel as well as our patients. So the further background is that medicine has about 24 specialties with so many subspecialties. Same goes for veterinary medicine. They have 3 specialties and 17 subspecialties. Nursing also has lots of specialties. And so as pharmacists, why shouldn't we be recognized for our training and the value that we provide? And why shouldn't we also be paid for our training and the value that we provide? Because I know that there are so many pharmacists who actually have specialized in one area or the other. However, because we are not, this scheme of training has not been really recognized, we are not getting the value or the payment and the recognition that we require. So overall, the movement towards recognizing advanced practice in pharmacy represents the progression of our workforce. So there are some challenges and some barriers that we are facing, and one of them includes differences in the structure of healthcare systems. Now, one of the reasons why we have a lack of agreement towards advanced practice or specialization is because different countries or different healthcare systems have different structures. And since we're not able to make these healthcare structures similar or the same, because, for example, what will work or the kind of healthcare system that we have in UITH might differ from the one that we have in Lagos State University and Teaching Hospital, might differ from the one we have in other healthcare systems. So this differences causes a challenge. So there is lack of agreement on what exactly an advanced practice should constitute. Also, the variances in scope of practice. Now, there are several areas of practice as pharmacists. So this could also be a challenge or a barrier. Then finally, interprofessional rivalry. For example, among doctors, pharmacists, and nurses, there's this rivalry, and to specialize or to have an advanced knowledge as a pharmacist, you need to go through a residency program. So if there is no proper collaboration between the various healthcare professionals, there could be a problem in being certified as a specialist or as an advanced practitioner. So now, I mentioned earlier that this was a study that was carried out at the University of Ilorin Teaching Hospital. So the objective of this study, that is the need for hospital pharmacists gaining specialization. The main objective was to check pharmacists' perception about having formal certification processes for pharmacists in Nigeria, and to determine some models that we can adopt for specialization. So now, this is the model we used. We searched using various search engines like PubMed, and we also searched and reviewed the Board of Pharmacy Specialties in the US, as well as the European Union, Trent in Australia, and certification processes in Quebec, that's also in Canada. So in UITH, we developed a questionnaire, and then we distributed this among the various hospital pharmacists, and the data was extracted so that we can gain ideas on certification process in Nigeria if we were to have one. So what we found out is that in the US, specialization of pharmacists is well recognized, and it is provided by the Board of Pharmacy Specialties. Also in Canada, it's well recognized, but they have to gain this certification from the Board of Pharmacy Specialties, which is in the US. Same goes for Quebec. The specialization has not yet been recognized generally, but it is ongoing, excuse me. So pharmacists who feel or who think that it will be of much advantage to them, go ahead to get this certification from the Board of Pharmacy Specialties. Also, same thing is applicable in Australia and in Europe. Then here in Nigeria, we also have specialization, although it is not widely recognized, but the West African College of Postgraduate Pharmacists confers various specialties on pharmacists that undergo the programs. I would like to skip this. Okay, so some of the programs or some of these areas of specializations that are available currently in the US are nuclear pharmacy, which happened to be the very first area of specialty where pharmacists started gaining specialty, as well as nutrition support, oncology pharmacy, which is quite common now, critical care pharmacy, pediatric, cardiology, infectious diseases, and others. So now, from our research, some of the reasons that we saw for increased demand of pharmacists that have specializations in various fields includes pharmacists themselves seeing the value of certification. So the most important, or the number one thing that is important, is that pharmacists ourselves, we need to see a need for us to have these certifications. Then secondly, recognition by peers. Like I said earlier, being specialized in any field, even if it's not pharmacy, if you are specialized in a particular field, you are more visible to people. You're more visible. So anyone who has a particular ailment in the line of what you work for, they will prefer to see a specialist than to see a general practitioner, because of course the specialist will have in-depth knowledge. Then also, it's a requirement. Having this certification has become a requirement for the Faculty of Pharmacy members to have. So without this certification, the members of the faculty cannot teach or cannot lecture. Then also, employers are beginning to see a need for those that have these certifications. Then in Canada, we found out that the National Advisory Committee on Pharmacy Practice, as well as federal government of Canada, saw that having specialties were required to reduce the number of drug therapies, because of course, some of our patients are burdened with so many therapies, and sometimes, it's one side effect of a drug leading to having to use another drug and things like that. So a pharmacist present in this healthcare team will be able to help limit the number of drug therapies that a patient uses, and ultimately even limit the cost of drug therapy management. Then secondly, they're having an aging population. However, like we all know, our population is getting more knowledgeable, and they even demand lots of information, because if you see a patient now, they ask lots of questions, unlike before. So they want to know more. And you having this specialty would help us as pharmacists to be able to answer better the questions of our patients. So, okay, then finally, pharmacists in Canada have also seen a large need for specialization. Moving ahead, in Quebec, there has been regulations, but they are yet to be implemented. So specialization is yet to be fully recognized there. I would like us to, okay. So this is a medical model that we can adopt as pharmacists. We can decide to adopt the same method that is used in medicine, that is going by the various fields that are available. So for example, we can see here, there is psychiatry, there is internal medicine. So we can have pharmacists specializing in cardiology, nephrology, gastroenterology, and the likes. Also in Europe, there are areas of additional education, such as intensive care management, rare diseases. And over time now in Europe, it's now it's becoming a requirement that as a hospital pharmacist, you need to have advanced practice beyond your normal 5 years practice as a pharmacist. So it's becoming a requirement. And as a result, more and more hospital pharmacists are beginning to get trained or get certified as specialists and advanced practitioners. So here in Nigeria, qualification includes a 2-year postgraduate program that includes residency, and this certification is conferred by the West African Postgraduate College of Pharmacists. And some of the areas of specialization are clinical or hospital pharmacy, community pharmacy, social and administrative pharmacy, public health pharmacy, and all of these areas have their different subspecialties. So you can find cardiology under some of this. You can find there are various areas that we can choose or decide to specialize as hospital pharmacists. So the area of specialization models that we can adopt to specialize can depend on the type of patients that we are attending to. We can specialize based on the age of the patients, for example, elderly patients. So you can decide to look at patients who are much more grown, and sometimes some of the problems that these patients face include polypharmacy. So a pharmacist that is specialized in geriatrics will be more knowledgeable when it comes to polypharmacy and everything that has to do with disease care, disease management for elderly patients. Also, a pharmacist can decide to be a pediatric pharmacist, and that is pharmacist for younger children. Then also we could specialize based on body systems, like I said, say the cardiovascular system or the hepatic system. So you could have pharmacists who are specialists in hepatology or in cardiology, and based on body systems. Then finally, it could be based on location of practice. For example, the pharmacist who is the critical care pharmacist. These pharmacists are usually in the emergency room, and they have more knowledge when it comes to shocks, burns, hemodynamic monitoring, analgesia, and things like that. So these are some other areas of pharmacy that we can specialize. There are so many areas, depending on our interests, depending on what we really want to work on, we can decide to specialize in any of these areas and so many other areas that are available. Okay, so this is an overview of the study, of the survey. So we looked at factors that would affect pharmacists' decision in getting certification. So now here in Canada, we can see that basically the most important reason or the most important factor that would affect Canadian pharmacists is their need for personal and professional growth. And then coming down to UITH, this is also similar. We can see here that most of the pharmacists in UITH want to get certified so that they can provide a better pharmaceutical care to their patients. And as far as I know that there are many pharmacists in UITH who have gone in various areas and specialized in various areas. I think I know of oncology, pediatrics, and cardiology, and drug information. So having this specialty confers this recognition and prestige on our profession. And I think it would benefit every one of us to go ahead and specialize in various areas. I would not want to burden us with these charts. So thank you very much.
Thank you so much, Pharmacist Ojo, for that insightful presentation. I must say it was very much enlightening and eye-opening. I believe that those of us here, we have already seen the need for advanced pharmacy practice and specialization. We can see that it is a necessity, no matter the barriers or obstacles that might come alongside it. It is a necessity that will start, even though as little as we can. We will start from somewhere, and that should be our goal at this point in time. So we have another speaker to talk further on this topic, and he is pharmacist Oyerin De Abdul Salam. So pharmacist Abdul Salam.
Thank you very much, pharmacist Usifo. Once again, you're all welcome to this clinical meeting. I'll take over from the UITH survey, which was carried out via a questionnaire. And pharmacist respondents were asked whether they agree with a number of reasons as why pharmacists need to specialize and be recognized through a formal certification process. And quite a number of them actually agree. Most pharmacists agree and the prestige they deserve. That is, we will be able to impact more of what we know with respect to patient care and therapy. Then a lot of pharmacists agree that it's specialization would better promote their specialty services. You know, when you have so much knowledge about a particular aspect of hospital practice, you tend to read well and just gather more information than when you have bulk knowledge about a lot of areas in hospital pharmacy. Then 70% of pharmacists support that a certification and formal recognition process should be available in Nigeria. And I think we have that, as the former speaker has said. It's just the recognition that we are still struggling to deal with. So about 60% also agreed that formal certification will provide us with greater confidence in knowledge and skills. When we specialize in an aspect and we confine our knowledge and attention to that particular area, we tend to actually have a lot of information at our fingertips. We bring out this knowledge, these skills at a very, very quick rate than when we have a lot of bulk knowledge. Finally, I think 60% agree that specialization will enhance the patient's access to pharmaceutical care. The next slide, please. Then these are just some factors affecting specialization and barriers. Then, as we've mentioned earlier, absence of formal recognition in practice areas, and I think we are trying very much to do that. Then, certification is not a requirement for practice. As pharmacist Ojo pointed out that in Canada, I think it's now a requirement for practice for you to have certification in advanced practice, and probably a special, you should specialize in an area of hospital practice. Then the cost of certification. A lot of pharmacists here in Nigeria feel like the cost of certification for advanced practice and specialization is on the high side. Then the structure of healthcare system. The structure of our healthcare system in Nigeria is not harmonized. When you get to another state, it's a different structure entirely. The UITH will be different from the one in Lagos and the one in Ogun and all. So those are the factors that are affecting specialization in Nigeria right now. So why specialization? You have quite a number of reasons why you have to specialize, especially from the patient's perspective, because hospital practice has moved from the traditional roles of just dispensing and assessing prescriptions to patient care, patient-oriented practice now. So these are the reasons why we have to specialize, for us to actually have to give better therapy and delivery to our patients. So we have reduction in mortality rates, reduction and elimination of medication errors, especially from the prescribing stage. If pharmacists specialize in an area or an aspect of hospital practice, it is easier for us to actually eliminate or reduce medication errors from the prescribing stage. Patients don't need to start using easier. Okay. So then we have reduction in adverse drug effects. When pharmacists specialize and specialty pharmacists assume pharmacotherapy as a member of multidisciplinary healthcare team, you find out that the rate at which we see adverse drug reactions will be reduced compared to when pharmacists don't specialize. So even if there is ADR, a pharmacist that is specialized in the area in which this particular drug is eliciting its reaction, will be able to actually pinpoint the particular drug that is responsible for a particular reaction, and the adverse drug reaction will be managed better if we have a specialist pharmacist. Then adequate drug therapy monitoring. Um, Drug therapy monitoring, it involves the measurements of medication levels in the blood stream, as we all know, at constant intervals, so that we optimize individualized dose regimen for our patients. So especially for drugs that have narrow therapeutic index. So if patients, we need pharmacists to actually specialize in this kind of area, so that we actually monitor the therapy, so that we don't give underdose or overdose of this particular medication. Then next thing is the slide is not actually showing this, it's showing more of advanced practice. I think right now there are some things that as pharmacists or as departments of pharmacists in teaching hospitals that we do that I think we need to stop. And a typical example is bulk dispensing to the wards, to the nurses, so that, especially for drug, most especially poisons, I think we give them anesthetics and all these things, and a pharmacist will not be there to actually monitor how these drugs are being given, the dose, the effects, how the patients are they doing better with this medication or not. Then I think we have to decentralize our practice as far as hospital practice is concerned. And I know that okay, and I know that we are trying in that aspect too. So I will invite pharmacist Shemiri to continue and discuss the recommendation and conclusion. Thank you very much.
Thank you very much, pharmacist Abdul Salam. I'll be talking on the conclusion and recommendations drawn from this survey. To the conclusion, the need for specialization cannot be overemphasized. That is, there is an absolute need for specialization in hospital pharmacy practice, as this would enable pharmacists to have acute knowledge and understanding of patient pharmacotherapy, also a better understanding of acute and complex episodes of illness, and prompt response to population's complex needs in pharmacotherapy. As said earlier in the discussion by pharmacist Abdul Salam, the hospital pharmacists in the University of Ilorin Teaching Hospital who responded to this survey supported certification of pharmacist specialization in Nigeria, because specialization would actually give pharmacists the recognition and prestige they deserve, and also specialization would further boost the confidence of pharmacists in their knowledge and their skills. Next slide, please. Now to the recommendations. Study on needs assessment should be carried out on a larger scale. That is, this kind of survey should be extended, should be further extended to other hospitals in the country and also to other countries at large. Also, a review of the pharmacy laws by incorporation of specialization in the existing laws guiding the pharmacy profession in the country. Also, review of existing curriculum to expand and improve through residency training program. The residency training program is actually being held currently at the West African Postgraduate College of Pharmacists, but I feel it still needs a more solid backing, as this would further encourage pharmacists, more pharmacists to enroll in this, to enroll in the residency training program. Also, School of Advanced Studies, that is, schools whereby studies beyond the basic 5 years of education can be further given to pharmacists. Next slide, please. Also, research potential processes for the formal certification of pharmacy specialization in Nigeria by adapting existing certification processes to the Nigerian context. We can, however, we can actually adapt the methods and the processes being used by international bodies into the Nigerian system for the specialization process in hospital pharmacy practice in Nigeria. And also formal certification obtained through international certification process. That is, pharmacists can actually train abroad and obtain certification abroad, and also introduction of a Nigerian model for the formal certification of pharmacist specialists. Next slide, please. Also, collaboration of existing bodies, that is the Pharmacist Council of Nigeria, together with the Federal Ministry of Health, need to really work hand in hand for this quest for specialization in hospital pharmacy practice to be achieved in the country. And also, as said earlier by the two previous speakers, that pharmacists need to enroll in the available training programs. An example is the programs being held at the West African Postgraduate College of Pharmacists. Pharmacists need to be encouraged to enroll in order for this quest for specialization to be put in place. Next slide, please. And these are the references used for the purpose of this research. The slides will be provided for those who would need it. So these references can be checked and can be used for further study and further research in regard to this particular topic. Thank you very much.